Hello, everyone. My name is Maggie Ivancic. I am the social worker and center coordinator with UNC's Movement Disorders Center. And welcome back for session 2, where we're talking about how to build your team. And if you're watching these videos in or out of order, hopefully you've just heard from our speech therapists, our occupational therapists, and our physical therapist. And now I want to share with you about the role of the social worker and the role of mood and mental health in Parkinson's. So how can a social worker support you? Many times people are nervous when they first hear that a social worker is going to be involved in their team. A social worker is a generalist most of the time and can have really broad term in what skills can be used and to support you. So my role as a social worker on your healthcare team, supporting you with your Parkinson's disease journey, is very specialized and focused on what is important for you. I want to learn about who you are, what you love, who you love, and all the things that you value, and how I and the rest of our team can continue to support you in doing those things. So here's a list of a few of the ways that we do that. Social workers can help with short-term, goal-oriented therapeutic support by providing referrals to different resources in the area. If you've watched previous videos, resources could include support groups, could include exercise groups, could include, learning about any of your hobbies and figuring out how to connect you with those options in your area, specific to you. We can provide education about symptoms in Parkinson's, assistance with coordinating with your healthcare team, and finding out who to bring in when different symptoms arise. Providing a listening ear and different coping strategies, not only for the person with Parkinson's disease, but for your care partner, for your family, for the people who are supporting you in your life. And also discussions around advanced care planning. Advanced care planning is something that I just like to take a little bit of time to discuss at this time, because I think advanced care planning is important to have conversations around early and often. So if you're not sure what I'm talking about, I will share a little bit more about it here. So advanced care planning are those legal documents or doctor's orders that describe the medical interventions you would or would not want if you were unable to verbally tell your healthcare team what your wishes are. Advanced care planning is important. I think that anyone above the age of 18 should have an advanced care plan, because none of us are promised tomorrow. Anything can happen, and having these documents in place gives you a sense of control that you've thought about these different scenarios, different things that could happen, and you've thought about what's most comfortable for you, and that's going to be different for everybody. So it's important to think about what these medical interventions could be, and to think about who you would want to support you if you were unable to make decisions for yourself at that time. And this is described as a healthcare power of attorney, the person who you would trust to make your healthcare decisions on your behalf when you are unable to speak on your own behalf. So these documents do not provide any power, any power to anyone, as long as you are still able and competent to make decisions for yourself. Now, the next document is called a living will for natural death. And what that document does is it tells what your beliefs are, what the medical interventions you would or would not. And some of those medical interventions include a breathing tube, a feeding tube, artificial nutrition and hydration, antibiotics, those types of interventions and different scenarios that could occur. So the living will serves as a roadmap for your healthcare power of attorney about what you would or would not want if you were unable to tell them in that moment. I've provided a few links down here about UNC's UNC Medical Center's healthcare power of attorney and living will documents that you can print off yourself and look over and have notarized, and that is a legal document. Or there's another document called the 5 Wishes. I really like the 5 Wishes booklet. It's a booklet. It comes with your healthcare power of attorney, who you can designate, your living will, and it also includes 3 other questions that most legal documents just don't consider. Those questions are: how comfortable would you like to be? What brings you comfort? If you were unable to tell your loved ones, how would you want to be treated if you were unable to tell those who are around you? And lastly, what would you like your loved ones to know if at that moment you were unable to tell them? So I think that booklet is really good because it starts conversations and opens up conversations that you might not have or might not be prompted to have unless you're in a crisis or an emergency and no one wants to be making decisions at those times. So those are kind of the legal documents that I briefly wanted to mention. The other ones are orders that must be completed by a physician. And so the first one is called a medical order for scope of treatment. It's called a MOST form. It's bright neon pink. And what's unique about this form is it's similar to the living will, where it talks about interventions that you would or would not want. But what's unique about it is you have to talk with your physician about each of these scenarios, and it has to be signed by the physician in order for it to be an active order. So the MOST form gives you the opportunity to talk with your physician about what these interventions look like and what they might mean for you, and help you through that conversation a little bit. Another order, and I will say another unique thing about the MOST form is it has to be completed annually with your physician or it will expire. So again, just emphasizing the importance of having these conversations early and often, because things change. Your values change, your mind changes, and this form allows the opportunity to continue that conversation. And let's talk a little bit about code status. We're going to talk about 2 different code status: the full code, which means that if your heart were to stop at this time, then paramedics would be called and they would do all of the life-saving interventions, providing you medications, chest compressions, to bring you back, to restart your heart. And then the second code status is called do not resuscitate, which is if your heart were to stop at this moment, you wouldn't want that. You wouldn't want people to rush in and do all the interventions possible to bring you back and to restart your heart. And we know that each time someone's heart is restarted, depending on their age, depending on illness, that the recovery for your heart restarting is different based on those factors. So that is why it's an individual decision for each person about how they feel related to code status. And it's an important conversation to have with your physician and your medical team. So this is what advanced care planning is. This the legal side, the medical side, the mix of both. And if you haven't heard of these things before, I'd encourage you to look into them and start those conversations. If they are things that you already have in place, I'd encourage you to find those documents, make sure that they're easily accessible, make sure that the important people in your life have copies of them, including your healthcare team, so that we know what's going on too. And make sure that your thoughts haven't changed. Make sure your mind hasn't changed. Make sure that they don't need to be updated. So that's my word about advanced care planning. Again, important to do in advance. It seems like we were talking a lot about death, what to do at end of life, but it's really about your quality of life and how you want to be treated. Make sure to choose someone who's going to respect your wishes and is going to seriously consider the information that you've put in the living will about the medical interventions you would or would not want. Make sure that there are copies available to people and re-examine them over time. Now, previously we talked a lot about Parkinson's disease and the motor movements that are involved with it. But let's talk a little bit more about those non-motor symptoms that can develop with Parkinson's disease. We reviewed a few of them are constipation, difficulty with sleep or fatigue, those cognitive changes. And I would like to focus a little bit on these three: apathy, anxiety, and depression. So let's focus on mood and mental health. When it comes to Parkinson's disease, it's important to monitor your mood and any changes that you feel like might be happening. Look out for signs of depression and anxiety, and that might be something that's new for you, something that you've never experienced in your life, or something that you have experienced with, but maybe you're noticing a change in symptoms. Maybe your coping strategies aren't working as well as they once did. It's important to let your healthcare team know about these changes, because 60% of people with Parkinson's disease report that they have increased feelings of depression and anxiety, which we know that physiologically can be caused by Parkinson's disease. The changes that are happening to the brain chemistry can result in depression and anxiety. But it also is important to know that it also could be due to coping with a chronic illness, integrating Parkinson's disease into your identity and figuring out what's going to work well for you. Change is hard, transition is hard, and it might take some time to figure out what that looks like for you. Depression and anxiety can worsen your motor symptoms. We talked a little bit about this before, that if you're trying to hide your symptoms, that can actually worsen your motor symptoms and make them become more noticeable. Just like if you're experiencing a lot of anxiety, that might worsen your motor symptoms and make them more noticeable and just make things more difficult for you in general. So if depression or anxiety is interfering with your functioning, tell your physician, tell your social worker, because there are things that we can do to address depression and anxiety. No one should have to live with depression or anxiety, because there are things we can do to treat it, including medication, including non-pharmacological strategies, and mental health therapy. Sometimes therapy is a new concept to people, but it's important to explore if it might be right for you. I often counsel people to look into 2 or 3 different therapists to find a good fit, to find somebody that you trust, that you can talk to. Many times people say, I've got my care partner, I've got my family, I've got my friends. And that is good. And I am all for people having a good support system of people you can talk to. But oftentimes having someone who is non-biased, someone who is specialized, someone who is trained and talking you through these life transitions and coping with a chronic illness can really give you the skills to help you live better and live well. And this is a quote that I like to ponder about. The question is not whether the glass is half full or half empty, not if you're an optimist or a pessimist, but the question is, can you refill your cup? What are you able to do for yourself that makes you feel better? Again, let's talk a little bit about depression, some symptoms that can be involved with depression: lack of concentration, lack of interest in doing some of the activities that you love, isolating yourself, either increased weight gain or weight loss. These are things to look out for when it comes to depression. And again, benefits of therapy: practicing skills and strategies for coping from someone who is specialized and trained in evidence-based strategies. Having an outlet to talk about your stress and your worries about the future, and knowing that you don't have to live with that person who you're telling all of those feelings to. It's to an unbiased third party. And it's important that when you address your mental health, when you address the things that are going on the inside, that it gives you more energy to focus on your physical health, which is so important when it comes to Parkinson's disease, and having the energy and the motivation to stay active. So again, it's important for us to know about these symptoms so that we can address them as soon as possible. Let's talk a little bit about anxiety. I like to describe anxiety as when you're experiencing worry or concern about the past or about the future that is interfering with your present, that's interfering with your daily life. And so when you're noticing these feelings of anxiety, this worry about the past, or you're feeling a little out of control about what could happen in the future, none of us have control over the future or control over the past. All we can do is make decisions in this present moment. And so some of the ways to address anxiety without medication is exercise. When you're able to get out that energy that really develops when you're worried and when you're concerned, it can regulate your mood and regulate your body to calm down. Socialization, making sure that you're not isolating yourself, keeping hydrated, eating food that makes your body feel good, and plan to do something fun. Oftentimes with anxiety, it's good to get out of your house, get outside of your routine a little bit, or build these fun activities into your routine. Play your favorite song, play your favorite music, dance together, go to the movies, do a hobby that you enjoy to help calm yourself. And what's up with apathy? Apathy is often a new thing for people with Parkinson's disease, that you just are lacking that motivation or interest in the activities that once brought you pleasure. You're not depressed about it. It's just not an interest to you at this time. And often for the person with Parkinson's, it's really hard to see, or to see yourself from the outside that this is happening. More often we could hear from care partners about, well, they just don't want to do what they once loved to do, or they were doing on a regular basis, and it's becoming harder and harder to engage them in those activities. So this can be caused by Parkinson's regardless of depression, unrelated to depression, unrelated to cognitive impairment. And the thing about apathy is there's no medication, there's no magic pill that helps with apathy. The thing that helps the most is setting a routine and sticking with it. And that can be really tough sometimes. But knowing that apathy is real, it's happening, and the thing to do to get outside of it is to make sure that you're consistent with your routine, that you're staying active, that you're exercising, and and you're making sure that you're keeping up with your social engagements as you've been before. So those are the three mental health and mood symptoms that I think are really important for people with Parkinson's to keep in mind: depression, anxiety, and apathy. If these are symptoms that are coming up for you, I encourage you to talk with your healthcare team about it to see if there are strategies or medications that can help address them. And I'm looking forward to seeing you again in our third session of Parkinson's Disease 101, PD 101, as we continue this conversation about how to live well with Parkinson's disease, and we hear from our patient and care partner panel. Thank you.